Welcome to the series, Walking on Eggshells. I'm Amy Sales, a clinical social worker at the Sidney Kimmel Cancer Center at Johns Hopkins, where I've been providing grief counseling to those facing terminal illnesses for over 20 years. This series, Walking on Eggshells, is intended to provide you, the caregiver, with education, direction, and reassurance that you are not alone as you navigate this difficult journey. Cancer does not discriminate. You are going to need help to handle this. I will help prepare you. You are the role model. Now is not the time to give up control. A word of caution. Walking on eggshells. In this segment, I will help prepare you and your loved one for extended stays in the hospital. This could happen when surgery is planned, or it could be because a treatment requires hospitalization. There are a few hints I can provide that will make your stay easier. As I've said over and over in this series, it will help keep you in control. Being in the hospital takes you out of your comfort zone. Your loved one is no longer at home. The hospital gowns aren't exactly the pajamas he got for Christmas, and the food lives up to every hospital food joke you've ever heard. And being in the hospital means getting poked and prodded day and night. It is not a good place to get a good night's sleep. As the caregiver, you can make this hospital visit easier. Bring comfortable pajamas from home. Have the kids make get well posters or cards to hang in the room. Hospital rooms have bulletin boards, a good place to put family pictures. Bring cell phones and computers so daily habits can continue. Don't forget the chargers. Favorite snacks are fine as long as there are no dietary restrictions. And yes, it's true, most nurses have a fondness for chocolate. Being in the hospital isn't being on vacation. Some friends and family don't get that. What should be a short visit turns into a day-long event. This is when you take control again. Long before anyone walks into the room, know who plans to stop by. Tell them the visit must be short, and don't be afraid to ask them to leave. Patients need to be a part of the process from day one of diagnosis and throughout the course of their illness. When it comes to breaking bad news, I advise patients or families to prepare for the worst and hope for the best. There are reasons why information should be shared. It is my belief that patients already sense they aren't doing well. It becomes the elephant in the room. Your loved one may want to stop treatment and spend time at home. It's time for advance directives to be completed and affairs put in order. And it may be time to start saying goodbye. Remember, you are walking on eggshells, and for you, the caregiver, this is very important in order to prevent a sense of regret. I talk about this like it's easy. This isn't easy. This is the hard part. But remember, even now, you're in control. Walking on Eggshells is a series of segments designed to guide you, the caregiver, through this journey. I invite you to continue to view these segments.